Dale Decker was a 37-year-old husband and father from Wisconsin, and his nightmare began after a back injury. On the way to the hospital, he ejaculated 5 times in the car, and the orgasms haven't stopped since. He now says that he can have up to 100 a day, and far from these being pleasurable, they're exhausting, humiliating, and deeply isolating. He even reports that he once had 9 orgasms while kneeling beside his father's casket. In public, he lives with constant fear, as episodes have happened at the grocery store, in front of strangers, and even in front of children. He's lost his job, his intimacy with his wife has collapsed, and most days he's even too afraid to leave the house. And then there's also the story of Kim Ramsey, a 44-year-old nurse from New Jersey. For Kim, even the smallest amounts of movement, a bump on the road or a train ride, can set off another climax. She reports that she once endured 4 straight days of constant orgasm after sex with a new partner. She has tried everything from sitting on peas to exhausting herself with exercise, but nothing seems to work. The result is pain, exhaustion, and an inability to have normal relationships while feeling judged and misunderstood. Now, the emotional fallout is huge from this condition. Depression and anxiety are common, and relationships often break under the strain. Some patients become socially isolated, unable to work or even leave the house for fear of public episodes. Completely understandable. And tragically, suicidal thoughts are not rare, simply from the feeling that there is no escape from this awful condition. Now, these nightmare scenarios are essentially what patients with persistent genital arousal disorder, or PGAD, go through on a daily basis. And interestingly, for this channel, starting or stopping antidepressants can trigger PGAD. This is a rare side effect where your body's arousal systems misfire, flooding you with constant sexual stimulation that you didn't ask for and you can't switch off. And for many, it never goes away, leaving them trapped in one of the most distressing and misunderstood conditions in medicine. So what is PGAD? Well, PGAD isn't about desire or hypersexuality, not at all. People with PGAD do not experience increased libido. In fact, many lose interest in sex altogether. What they do experience is a neurological glitch in the body's sexual arousal pathways. These symptoms can trigger constant throbbing, swelling, tingling, or pressure in the genitals, and orgasms may happen repeatedly and without warning. But instead of relief, they often bring frustration, disgust, or even pain. Now, Dr. David Healy, one of the world's experts in PGAD, has put together a diagnostic criteria for PGAD. And here are the most common features. The arousal persists for a long period of time. It doesn't resolve after an orgasm. It isn't connected to sexual desire. It is unwanted and intrusive, and it causes serious distress. And what we've seen in the medical literature is that this is most often reported in menopausal women. However, some men can develop it too. Now, outside from side effects from antidepressants, PGAD can be triggered by spinal injury, nerve problems, and congestion of pelvic blood. But let's focus on the antidepressants now. Why do they cause it? Well, it turns out that SSRIs and SNRIs don't just affect mood, they alter the serotonin system in the brain and spinal cord. This is the same system that helps regulate sexual function. Now, normally there is a balance between the accelerator signals that promote arousal and the brake signals that hold it back. Antidepressants can shift that balance in ways that are poorly understood. And so when you start or stop them, the changes in serotonin signaling can disrupt the nerve circuits that control sexual reflexes. For some, this leads to nerve overactivity, that is, the brakes fail, but for others, it can lead to numbness. And in fact, PGAD is actually the mirror image of Post-SSRI Sexual Dysfunction, or PSSD. In PSSD, people lose sexual sensation completely. They even report feeling like their genitals have been anesthetized. Now, Dr. Healy in his research has gone on to talk about both of these conditions, and he has seen patients that actually shift between states, where they start with one condition and they eventually shift into the other. This suggests that PSSD and PGAD are actually related and are both problems due to the same disruption to the serotonin system caused by the antidepressants. Now, what about treatments? Currently, there are no proven cures for PGAD, and treatment is really trial and error. Some doctors try to calm the overactive nerves with anticonvulsants like pregabalin. Others use antidepressants like clomipramine or duloxetine, which can actually blunt sexual reflexes. This is surprising because these are the very drugs that can actually cause this condition, but for some patients, another one of these medications will bring down the stimulation. And in rare cases, hormonal suppression, Botox, or even pelvic nerve surgery have been attempted. Outside of that, obviously counseling and couples therapy are needed to help manage the psychological and emotional distress of this disorder. And finally, PGAD may be more common than reported. With a condition like this, it is often very embarrassing and patients will not bring it up. On top of this, doctors do not warn patients that they can develop this side effect when they take antidepressants. And currently, it is not listed in any of the drug labels. And this is why, if you suffer from this condition and you believe it was triggered by an antidepressant, it is incredibly important that you report it to the FDA through the FAERS database. If you're looking for a deeper dive into how these drugs can affect sexual functioning, you're not going to want to miss my interview with Dr. David Healy, where we discuss everything that you need to know about PSSD.